Okay, so I wanted to come really quickly just to show you the medications that I take in a day. The first thing I do when I wake up is I check my blood sugar levels. I keep my diabetic supplies inside this little cute pouch. Well, I think it's cute. But I check my blood sugars, and immediately after, I take an injection. This is a long-acting insulin, so I take 30 units of this every morning. And this is supposed to keep my blood sugars kind of steady throughout the day and within a normal range. So this is what I take first thing. Now, depending on my blood sugar levels, if I wake up, which it has happened before in the past, if I wake up with blood sugar levels over like 160, then I take a short-acting insulin pen, and it's this right here. It depends on how high the levels are, but I would take anywhere between, like, I guess at the minimum 5 units and maximum like 15, 20 units, depending. It's on a sliding scale, so depending on how high my blood sugar levels are, I'll take a couple of units of this before meals only. So this is only to get my blood sugars down rapidly. So the next thing is I kind of separated my pills in the time spans that I take them. So this right here, these are my Metformin tablets. And basically in myasthenia gravis, what happens is your immune system is attacking the signals between your nerve and your muscles. Metformin increases the signals between your nerves and your muscles. But the thing is that Metformin only stays in your body for a few hours. So most patients that take Metformin has to take it, every 3 to 4 hours or 4 to 6 hours or as needed. So I take a pill and a half. These are 90 milligram. These are 60 milligram tablets, and I take a pill and a half, 90 milligrams every 3 hours. I don't take it at 3 a.m. and I do take it at midnight and at 6 a.m. So that's my Metformin. So the next pill I take is prednisone, and I take this in the morning. And this is a 50 milligram tablet, and this is a half of a 20. So I take 60 milligrams a day. And prednisone is an immunosuppressant. It's a steroid, and it suppresses your immune system because it's your immune system that's causing all the problems in myasthenia gravis. So people take prednisone to kind of quiet down the immune system and keep it from creating those bad cells. Another immunosuppressant that I take is Imuran, and I actually take, these are 50 milligram tablets, and I take 2 in the morning and I take 2 at night. So this is another immunosuppressant. The point of Imuran is to kind of get you off of the steroids because steroids have such bad side effects. So a lot of doctors prescribe Imuran as an alternative for prednisone. Unfortunately for me, prednisone seems to be the only thing that works for me for some reason, and I'm always on it, but I guess it helps. Imuran helps for those times when I'm on a tapered dose, and it helps me from getting weak when I'm on low doses of prednisone. So that's the Imuran. This is my Pepcid C tablet that I take. I take 20 milligrams. It's just, I get it over the counter, and I take it for my stomach because these medications cause a lot of stomach upset. So I take this in the morning to kind of help with that, and I only take it once a day. So then next, in the afternoon, I will take my calcium. I take 2 of these a day. So I basically take the Nature's Made calcium, and it's with vitamin D and whatnot. So I take this twice a day. This is Metformin right here. Metformin is an oral insulin that I take for the steroid-induced diabetes, and I take 750 milligrams of this, and I take this tablet twice a day. I take it once in the afternoon and then once at bedtime. This is a hair vitamin right here. It's called Hair Affinity. And it's a hair, skin, and nail vitamin, and I take it because basically I noticed that with all the, I don't know if it's the medications or if it's just because my immune system is compromised, but I don't experience like healthy hair growth. My hair does grow, but it doesn't grow, to me it doesn't grow the way it should grow at the normal growth rate. So I take a hair, skin, and nail vitamin. I also take it because my nails are very brittle, and I just figured, hey, why not? It doesn't hurt, so I take that. And then that's my Metformin. I take it again. So this is my vitamin C tablet. I take this tablet once a day. I take the vitamin C since my immune system is compromised and it puts me at risk for a lot of colds and infections and whatnot. I take the vitamin C to kind of help with that, to help boost my positive immunity. So that's vitamin C. I also take a B complex tablet. And I take that because my doctor told me to, pretty much. She said that I do have anemia and that the B complex would help with that. So that's why I take that. Then at bedtime, I take another calcium tablet, another hair affinity tablet, and another metformin tablet. And then I also take my Imuran again. So this is pretty much the medications that I take in a day. I also take D3, but I ran out of the prescription, so I have to get that prescription from my doctor. And I also take a multivitamin once a day, and I have to go pick some up from Walgreens. I ran out of that. So what I usually do is when I'm in the house and I kind of separate my pills for the week, I put all my pills inside of these compartments. And so I'll put it for morning, noon, evening, and bedtime. But of course, since I take Mestinon so frequently, I don't have enough compartments for my Mestinon. So I'll put the morning, noon, evening, and bedtime in here, but the extra tablets that I need, I will put it inside of these little pill pouches. But you have to be careful with putting Mestinon and things like this because Mestinon, they get very moist and they'll start to crumble. So you have to make sure you always keep it in a cool, dry place. These pill pouches are okay. They keep them pretty dry. I wouldn't keep them in here for longer than a week because I noticed that after a week of keeping the Mestinon in here, when I go take my Mestinon, it's like powder. So I also use these pill pouches, and I'll just, let's say for instance, if I'm going to run out or if I'm going to work, because obviously I can't carry this to work and whatnot, I'll just take everything and I'll put them in this pill pouch. Or if I really want to, really want to separate them out, I'll take a pill, like 4 pouches per day, or I'll just put them all in one pouch. It just depends on how I feel. So I use these pill pouches for when I go, and then I take the pill pouches and I put them right inside my bag. They all fit in my bag, and this is like my medicine kit. So I keep all my diabetic supplies, and when I'm on the go, I put all of my medicine in this. So there you have it. This is basically my daily regimen. And over here is my IVIG, which I'll be getting today. This is why I have this IV in my hand now, because I'm getting my IVIG. So there you have it. All right, guys, thanks for watching.